are back with another podcast. Today, super excited to be joined by Dorothy Kilroy, Chief Commercial Officer at Oura. Oura is a little bit different of a company for me. Usually Hospitalogy is in health system and value-based care and whatever else land. But today we're going to be talking about wearables and consumers. But Oura has also made a lot of recent inroads into kind of traditional healthcare settings. And so, Dorothy, thank you so much for coming on. How are you doing today?
Great. Excited to be here. And Blake, thanks for having me.
Of course. Thanks for taking the time. And maybe we can just jump right in. I'd love to hear your journey to Oura and your kind of career trajectory, and we can kind of go from there.
Yeah. Thanks, Blake. So I hail from Ireland originally, so you're probably going to hear this Irish brogue, which for the week of St. Patrick's Week, might even be worse. But I moved to the US about 25 years ago, and I was very excited to move to Silicon Valley where technology was happening. Sort of the thread of my career has always been drawn to these disruptive technologies. So early on in my career, I started in the payments industry, and I saw a lot of the disruption happening from banks to how we pay with mobile payments and how we, transfer money to each other with peer-to-peer payments. And I was very excited about that disruption, and maybe a lot of sort of the entrenched players of the banks, they didn't go away, but a lot of new players evolved around them. Then similarly, I joined Airbnb very early on when it was, known as a couch surfing brand, but it really started to disrupt travel and how people stayed in different places. And suddenly it democratized sort of access to that. And now my sort of like third chapter here is the disruption in healthcare, which I couldn't be more excited about. I think about disruptive technologies across my career, and often the industry is ready for it, right? They're excited for this change, but often you don't necessarily have all the technology, the regulatory landscape lined up, and you don't necessarily have all the players' incentives lined up too. I personally think this is one of the most exciting times to be in health tech because I think it's the perfect storm. And there is certainly lots of excitement and demand in the industry.
Yeah, absolutely. And I think that, your journey is so fascinating. But first, backing up, you mentioned St. Patrick's Day, and I also love your accent. Like, what's kind of your go-to thing to do on St. Patty's Week?
I love Irish food and music. So one of the things that I do, I have identical twin daughters that are 9 years old, and we bake soda bread. We make a sort of a traditional Irish meal, and then we very badly dance around my kitchen. So, don't think of this as sophisticated Irish dancing. One of the things that I particularly love about being Irish, you are encouraged to participate in any sort of like music, dance, poetry without having great talent. The bar is very low for what people expect. It's really just about the participation. And so while often sort of deemed as like, pub culture and the Irish are sort of drunk, I actually think that they are really just like joyful about participating in sort of these sorts of customs and traditions. So we just have a good time, honestly.
Yeah, you guys just know how to party.
We do.
Love to hear that.
We really do.
And my follow-up question, just because I promised my wife, is she says she really wants an Oura ring. Do you think we could get that hooked up during this podcast?
Sounds like your wife is a smart woman, and would love to help her get a ring. Particularly one of my passions, Blake, and one of the reasons I joined Oura, we really understand women's physiology. And it turns out that we are not small men, and that our physiology is really unique. So when you say your wife loves one, it warms my heart because we see such demand among females who really understand that their biology is different and they're trying to figure that out. It was one of the main reasons I came to Oura. I started wearing this ring about 8 years ago. It was really early days Oura. I was a typical sort of burnt out executive. I had 2 young kids and I was burning the candle at both ends. And, I thought health was sort of running a marathon or, like having your diet perfect. I thought that was what health was. And what I realized is that it's much more personal and complicated for the season of life that you are in. And, without sort of that feedback on your own physiology, your own biology, it's actually really hard to know how your body is reacting to certain things. So sleep is a perfect example of that. Stress is another good example of that. And I would love to get your wife a ring and make sure that she can kind of juggle all those things too.
Yeah, no, I appreciate that. And I think that passion point is so great and interesting. It's funny you say, we're not little men or whatever. And I think Oura has found such a niche, starting niche with women's health. And maybe I'd love for you to kind of expand on that. And, what have you guys done recently in women's health, and how have you kind of, because I know like with my wife and her friends, like they're really focused on fertility. And I know that's a huge thing for
Yes.
you guys. How has that kind of grown over time?
Yeah, so one of the things that we started with, it turns out, this is a continuous monitor, right? Your Oura ring is on you 24/7, and because we're not another screen, another mouth to feed, we have really good battery life. So most of our members are getting about 7 days battery life before they need to charge it. Where it sits on the body too, if you go to a hospital, you'll always notice they put the pulse oximeter onto your finger, right? Because it is the best signal. It's 100 times better signal than the wrist. The wrist has bone and hair, and it's actually hard to get that signal. So this really matters when you're trying to measure really accurately key things. And so I'll give you an example for women why this is so important. So we've never really had continuous monitoring of temperature, right? We sort of spike a temperature with a fever, and then we will measure our temperature. And it turns out that our temperature is incredibly sensitive to our hormones. And so monitoring your temperature and having a continuous baseline and then starting to see the deviations gives you an excellent correlation to what is actually happening with your hormones. So with a very high degree of predictability, we can predict when the female is about to start their menstrual cycle, when they're in their fertile window, and kind of like looking at the phases of their cycle. Cycle health is a really important vital sign for women, not just for reproductive health, but to actually explain their different rhythms, how their sleep, their stress, their metabolic sensitivity is responding to that. And so at the very core, we started with cycle tracking. And it was this huge unlock for women because they weren't guessing. They were getting this like very accurate reading, and they were able to plan their life around it. And of course, that went into reproductive health, right? I'm so proud that we have so many of our members that are using Oura to support their fertility journey, whether that is trying to get pregnant or trying to family plan and not to get pregnant, but they're using their temperature to inform that. And by the way, our algorithm is more complicated than just the temperature. We look at like your SpO2, we look at your heart rate, we inform it with a bunch of other sort of key metrics that will then sort of triangulate around that ovulation moment. And so women are using it. We've begun to add more features to that. So for women that are pregnant, we help predict the gestational age of the baby and where they are in their trimester. And then we give them insights into what that means. So when you're in your early trimester, you will feel like more fatigued and more tired versus later in your pregnancy. And so we correlate to that, like what is happening actually with your heart rate and where those changes are. This is really the first time that women have been empowered with this continuous data in some of these journeys that can feel really lonely. And you're waiting for those moments when you go to a doctor's office to sort of like to understand where you're at. Now I'm proud to say that we empower women with their own data on their own physiology. And we also work with the physicians too, to give them an understanding of that data. And so that's a more informed and better conversation between both of them. More recently, we've launched features around perimenopause. That is a high demand space for our members, again, trying to understand the changes in their physiology beyond just their cycle, their overall physiology. And we really have invested very heavily in our AI here, building, actual models based only on women's physiology. And that's really unique in the industry.
Yeah, and I love that. And it's so interesting because you talked about quite a few things there, and I'd love to get into, because you guys started and still are a consumer facing company in wearables, but now you're kind of moving more into like the enterprise side. And so you're almost starting with, better engagement, users that love you and those sorts of things. And I'm curious, like, as you're kind of moving into, you've notched partnerships with Essence Healthcare and Medicare Advantage and other, I think other payers and Maven and maybe a few others. Can you talk about how the kind of initial success with the consumer and just this rise in consumerism translates into, better commercial viability?
Yeah, I started by talking about the different industries that I had worked in technology. And I've always seen a typical trend, which is when consumers really demand change, they act and they behave and they take action on trying to understand that. And I think we are seeing sort of consumers be the CEO of their own health for the first time. They really want to be empowered with their own data. They want to understand it. And for the first time with LLMs making that actually even more democratized and the knowledge more democratized, they're very fluent and they are like empowered and they want to understand it. Now, there's a lot of misinformation and there's a lot of confusion still out there, but they are, in a much better place than maybe we were 100 years ago in understanding health, if we sort of think in those timelines. Aura began really helping people understand sleep. And it turns out because we have this great accuracy and where we sit on the body and this long battery life that you can wear it overnight. And this was a powerful entry point because sleep is really universal, right? We all sleep. And it's deeply connected to every other health outcome. But it also turns out that while you are at rest at night, it is a wonderful time to get a baseline reading of your physiology, right? I often think about when I go to my annual doctor's visit, right? I've probably pounded a bunch of coffee. I'm really stressed. I'm probably, trying to juggle it in between work and family life. And, if it's early in the week, probably a workout too. And that often is just a snapshot in time, right, of my different sort of physiology and my readings.
Yep.
And if you have sort of my baseline, we could take hypertension as an example. If you have my baseline understanding of that, seeing the deviations from that is really interesting. So this was a great place for us to start. But we've expanded much more beyond sleep, although we're still known very much for our sleep. Women's health that I talked about a little earlier, cardiovascular health, stress, resilience, metabolic health, all these sort of key important areas of health. And what makes us interesting for that consumer, for that user, we call them our members, the Oura members, is we're not just one metric. It's the ability to understand patterns from continuous longitudinal data against your own biology. So we're not creating a sort of a standard of Door's metrics versus every other female her age. We're looking at door versus door. And that's really different in how we look at physiology. We've always wanted to get to personalized healthcare, and that has always been really challenging, although everyone agrees in it. And so we finally have the types of technology and the types of products that I think could get us there. And that evolution has moved us closer to healthcare. We're increasingly seeing healthcare companies approach us because we're translating those everyday biometrics into actionable insights that matter in clinical and care management settings, not just in consumer wellness. And this has been kind of the exciting thing in the last couple of years, Blake. And maybe most importantly, I think the healthcare community has really seen how we have been grounded in research and being very rigorous on that. Our work with academic and clinical partners from sleep studies, at Stanford and at Harvard and accredited institutions so sort of physician well-being and women's health research and partnering with some of the most innovative companies there. That's helping us strengthen sort of a collective understanding how social, behavioral, and environmental factors can influence your health over time.
Yeah, and I love that kind of research angle and being grounded in kind of evidence-based. So I'm curious, as you guys are kind of at the forefront when it comes to, insights and engagement and those sorts of things and hearing from your members. Has there been anything from a research perspective or just like from an anecdotal perspective where you've heard something and that's been kind of, different than, maybe the standard of care or like kind of insights that you're like, oh, like we're actually learning things like that PCPs need to know, like that kind of thing?
One of the things, let me talk specifically about an example. So we are partnered with Essence, which is part of the Lumeris network, a Medicare Advantage program. And this has been a really great partnership for us. What's most exciting to me about this partnership was actually seeing the engagement that we're seeing with those members that are over 65 and how they are interested in their health. This has been really surprising to Essence and their physicians too. So we see very high membership enrollment in the program. When they opt in, they can avail of an Oura ring, and that data is then available to their physician. But we're seeing almost 6 times the engagement that Essence has seen from other programs.
Wow.
And so what they're getting is a much more engaged user in their health. And that is just not typical in the industry. You don't typically see metrics like that. Members are visiting the Oura app, 3 to 4 times a day on average. And most of them are active 5 times a week. So 77% of them are active 5 times a week or more. So they're seeing this increase in sort of activity. They're wearing the ring on average about 23 hours a day, 23.8 hours a day. So almost like the full 24 hours. And so we're seeing sort of this like high engagement, changes in behavior. And that matters because it isn't just about passive distribution. Members that are actively engaging are getting those insights, and that opens up something bigger. Connected member care. So when you move from sleep to heart health to resilience to recovery, you get this big picture. And that can help plans and care teams support members more meaningfully over time, right? Because they're seeing this much bigger picture. So to me, Essence is kind of that proof that if you give members something compelling, intuitive, useful, you can kind of unlock this very different level of participation in health. And one of the hardest things in healthcare is trying to get behavior change. I'll give you another just good anecdotal example because we talked about St. Patrick's Day earlier, but one of the biggest behavior changes we see with Oura members is their relationship with alcohol. And most of our members kind of discover for the first time the impact alcohol has on their health. Now, we'd all like to think we defy gravity and that just won't impact us. But when they see the impact on their own physiology, it really makes them change their behavior. So we see about a 20% reduction in alcohol intake. Again, that's a very hard metric to move, right? We have all the studies, how bad alcohol is for our health. We can have the warnings. We can have physicians and care teams talk to the patients about this. But actually changing that behavior has been historically very hard. And I think when people see their own physiology, the high heart rate, the low HRV, the higher stress levels, the reduced sleep quality, like their deep sleep and their REM sleep, they're suddenly like, oh my goodness, this is really impacting my health. I'm going to be more thoughtful how I approach alcohol in the future.
Yeah. Yeah. I love that. And yeah, I've seen all the screenshots and I have experienced myself with seeing that, the recovery drop or whatever. So it's pretty brutal.
It's brutal.
So I'm curious, backing up just a step around, you mentioned Essence had maybe tried other kind of engagement protocols or whatever it is. What do you think it is about Oura that makes people so engaged and like they want to interact with the app and is it just the form factor? What do you kind of think is y'all's like differentiation in kind of a crowded space?
Yeah, I think it's a few things. I think, first of all, because it is so easy to wear. I mentioned there's not another screen, another mouth to feed, another sort of digital intrusion in our lives. We all have enough of those everywhere we interact. I think that's first. So the continuous wear, the ease of use. The second thing is I think a lot of wellness programs or health programs, they've suffered from sort of this engagement that I mentioned. And they may be well-intentioned, but they don't offer something that members, consumers can genuinely get excited about using consistently. And I think Oura sits at that sort of intersection of desirability and utility. it's a product that people increasingly want. And that form factor supports that high compliance. And then users tend to perceive benefits quickly, right? So within 30 days, most of our members, 90% of them report an overall improved health, right? So that's like that virtuous circle. 88% see better sleep, right? And so they're starting to sleep better, and that feels good. 81% see reduced stress, and almost 80% higher productivity, right? So you see all these things and your behavior starts to change and it starts to feel good. That combination is powerful in a benefit setting, right? If utilization matters, and it always does, then you need an offering that members will actually adopt and continue using. I mentioned sort of the average sort of ring time is about 23.8 hours a day, which makes that uniquely well suited to do something like that. And we're seeing more broad adoption with payers. So we have a great partnership with Cigna. And what Cigna is very strategically focused on sort of creating a wellness sort of strategy and being at the sort of the innovative forefront on that. And they're realizing that you can't just bolt a wearable on to any old care model and expect transformation. The bigger opportunity here is to sort of redesign a lot of chronic care and member engagement around continuous, worn, high quality biometric data. And if you have that intelligence layer, it helps sort of surface what matters to those care teams and to the member.
Yeah. And that's interesting. I'd love to maybe dive into the Cigna partnership a little more. Because I'm just curious, generally speaking, like remote patient monitoring is a thing, right? Obviously, I would assume they've tried some sort of programs around that and or have existing programs. So how would you say Aura is different from like a, remote patient monitoring company, if that makes sense?
Yeah. So I think our work with Cigna really reflects this broader shift that we're seeing in the industry. Health plans and employers, they want wellness offerings that members and employees will actually value and use, right? They've seen low adoption on some of the best well-intended programs. But our relationship with Cigna and sort of the employer clients that they have the ability to offer Aura as part of their wellness program. So employers can choose to cover the cost of the Aura ring, which makes it sort of easier to embed into the broader workforce. What's encouraging about the early response, we saw hundreds of day one responses and strong initial interest, which sort of reinforces this simple but important point that consumers are excited about products that feel relevant to their lives and that offer visible benefits quickly that I talked about. And so when it comes to remote patient monitoring, you really want that end user is actually engaged in it. From Cigna's perspective, this sort of fits into this broader prevention strategy that they have. And so for a lot of remote patient monitoring, it has kind of focused on sort of this acute care and not on sort of like this preventative care.
Yeah.
And
Gotcha.
from our perspective, it's another example of how Aura sits in kind of the overall sort of initiative that supports those care teams in that. And that just goes way beyond generic engagement. It starts to build actually towards more personalized, data-driven care so that the care teams can kind of understand a lot of those sort of like chronic care, condition, preventative care management strategies and to sort of keep that high engagement.
Yeah. And what I'm hearing is it just all comes down to engagement, right? And like you guys that's your secret sauce. So that's awesome.
Yeah, we've spent so much time and we have, 40 PhDs and MDs that work at Aura. And one of the things that they think about all day is the behavioral science and the behavior of people too.
Yeah, absolutely. And behavior change being such an important catalyst in healthcare, if we can get more people to kind of take charge of their own health and quarterback that and kind of alleviate the healthcare system and the cost there, I'm all for that. So that's fantastic. Something that I've just, had come up in anecdotal conversation and maybe some physicians and so forth is kind of the level of usability and or integration of, a wearables data within like the traditional healthcare setting, so to speak, right? So could you talk a little bit about just maybe like level of trust with that and like the integration of Aura's kind of actionable, what data is actually actionable and used today? And where kind of do you think there could be room for improvement?
Yeah, I mean, data is a really important and critical topic, especially right now. interoperability, I believe, is crucial if we want wearable data to become truly useful in healthcare. But we have to be really thoughtful about how that happens. So the goal, in my mind, is not to just dump massive amounts of raw data into an already overburdened clinical workflow, right? We hear that all the time. Clinicians don't need more noise. What they need is the actionable insights, the trends, the deviations, the changes, the risk signals, and the context that can kind of fit naturally into both virtual care and population health models and ways that they can do that. So when we think about data, we think about interoperability and we think about the filtered intelligence, not just sort of the data transfer. How do we make sort of wearable insights useful to providers without increasing the administrative burden or their burnout, right? How do we help patients and the providers connect the right amount of information at the right time? And maybe just as important is about privacy and consent being foundational. We never share user data without explicit permission, and we never sell user data, right? Like that is something that is very important to Oura. Any future healthcare integrations or any existing healthcare integrations or classifications would continue to follow kind of that same privacy and security principles. Health data is very sensitive and it should remain in the user's control in our mind.
Yeah, I love that. That makes a ton of sense. I am curious. So you recently launched Oura Advisor, right? Could you kind of dive into, I just feel like in general, like primary care and uh, in a way, you guys are a form of primary care, like a first entry point into, taking action with your health and those sorts of things. And obviously we have like the longevity players of the world who are saying, hey, you can, get all of these tests and have all your biomarkers. Do you foresee Aura expanding that offering and kind of moving more into that kind of almost like maybe not a provider in a sense, but just like a very robust supplemental companion to the PCP or those sorts of things? Does that kind of make sense?
It does. Yeah. So the Oura Advisor product is a product that allows users in the Oura experience to interact and ask questions to the advisor about their own health data. And it uses the Oura data as a foundational input to that. And it also supports broader questions. It is amazing to me to see how much people interact with it. Some of the things that I love to see is the time of day they're interacting and how often they're interacting. So when you step back and you look at it, I believe what's happening in the industry is people are interacting with their health more than they ever have. Because the access to tools like an Oura Advisor and other tools in the industry have really made that accessible. You're not rushed. You can do that at 9 p.m. on a Saturday night. The advisor never tires. It's always going to be there to answer your next question. And just that knowledge alone, we believe, equips members to then decide what they want to do as a next step and a next action. We've been very thoughtful how we've developed Advisor to make sure that we are not overstepping into any clinical advice or diagnostic or even prescription. But what we do help is provide the member with inputs to actually go take that next step. And we're very thoughtful about that. We don't believe doctors are going away. We actually think they're going to become even more powerful with these types of tools. And we think that the knowledge that the user and the patient and the member is going to bring to those conversations is going to get better. And AI has a huge role to play here, but only if it's built responsibly and really around use cases that are real. We're moving sort of from generic AI approach towards more of a personalized, empathetic, clinically informed conversation designed sort of with specific health contexts. So women's health is a great example here. I talked about this earlier, but it's been historically underserved and a one-size-fits-all data model. So we introduced our first custom LLM design and vetted by our in-house women's health clinicians that we have on staff. What's important to us is not just the model itself, but the design of the philosophy behind it. It's intentionally tuned to be non-dismissive, reassuring, emotionally supportive, which is a lot of the complaints women have in the healthcare system, so that women can better understand what's happening to their bodies and feel more equipped to have that informed conversation with the provider. Sort of more broadly, I think AI is how continuous data becomes scalable for support, right? It helps interpret signals, personalized recommendations, augmented care models without simply creating more work for the clinicians. That's where we see real long-term value, sort of a privacy first intelligent layer that helps bridge that data with real world health decisions. So I think as regulation changes, as the models improve, as our data gets better, I think this is actually going to become for a lot of people, they're sort of their front door, their first entry point into sort of a health discussion.
Yeah, yeah. And you touched briefly on regulation, and I know, and this is not a political podcast or anything, but I know the current administration has been maybe vocal about support for wearables and this kind of direction of letting consumers, patients take control of their data. How have you kind of seen that play out as a tailwind? And as an addendum to that question, where do you think regulation needs to improve for kind of this model to flourish?
Yeah, I'm really encouraged by the direction regulators are taking in recognizing the difference between early awareness and a medical diagnosis. So that has been really great earlier this year. We have seen that with wearable data. And I think this distinction matters. There's sort of a meaningful public health opportunity in features that can alert people to potential issues like hypertension, sleep apnea risk, without positioning the tools as a definitive diagnostic, right? That kind of early screening can help people seek care sooner, especially for conditions that go underdiagnosed. We have an IRB approved blood pressure and hypertension study we will launch in Oura Labs with the goal of sort of refining and validating a future feature for FDA submission. Participating members who are in this will be notified of their current likelihood of hypertension, so their hypertension risk, using the Oura Ring data combined with a brief questionnaire about family history, medication, lifestyle habits. And I think that sort of is like the bigger point here, is that innovation and oversight, they don't have to be at odds, right? I think there's thoughtful, modern regulation that can make it easier to be sort of responsible about preventative care to people and do that at a greater scale. So I get very excited about the progress that we're making on those fronts and recognizing the distinction in kind of devices and what value they can bring.
Yeah, I love that. It's funny. I feel like a lot of the times you talk when you're in kind of health system land or just traditional healthcare land in general, it's like compliance is the first checkbox. So people are like, is this technology secure? Like, can we get our lawyers involved? And so it's funny. I feel like there's this friction between, somebody like an Aura or like a health tech company who is like more so of the mindset of like move faster and break things versus the health system, which is or payer, incrementalism and, make sure things are compliant and then don't break anything because that's bad.
Totally.
um, I I'd love to step back a little bit just because I am curious. You mentioned earlier, you were an executive with two young twins. That sounds like a lot to take on. I'm curious, like, how did you manage that? How did you kind of navigate that world? And, were your employers empathetic to that? Because I have a 2.5-year-old, so I can understand the plight, especially with twins. So I'm just curious from a personal perspective.
Yeah. Look, I'm not going to pretend that I have this perfect balanced life. And I stared at a really poor sleep score this morning because I've been traveling this week and I'm juggling some stress with one of my daughters is facing with challenges at school. And at the same time, I'm trying to onboard a new employee and I'm trying to make sure that we hit our revenue numbers for the quarter. So I think the juggle is very real. So let me not try to pretend that I figured it all out. One of the things that my mom was a physician in Ireland. And so I grew up with a lot of discussions around our dinner table about the importance of health, the health in our local town. We had a small town, the health of our neighbors, our friends, her patients, and just how important that was. So I grew up with this feeling of responsibility for others. And I have no medical degree. I have nowhere near as smart as the wonderful people that I get to work with, and shouldn't even at times be allowed an opinion on it. But I really believe in democratizing health to more people, and it shouldn't be something that only privileged people can afford or educated people have access to. So when I think about sort of like my personal juggle of life every day, I really want my work to matter. And I think it does. I have this thing, and I know you have a 2.5-year-old, Blake, but I have this thing that I say to my daughters regularly when I have to go on a work trip, or I'm, not going to be home for dinner because I have a work meeting late. I'll say, hey, my work really matters. It's really important. And I love what I do. I'm sorry I won't be here tonight for that event, but what I'm doing is really important. And I tell them about it. I've also brought my daughters to the office. I really encourage people to do that and like let your kids in on your work a little bit more. I tell them about the challenges of difficult people that I have to work with and great people that inspire me. I really try to integrate them into that. And that actually gives me a lot more balance in how I feel about both work and home life.
Yeah, it's more of kind of a full integration rather than a more compartmentalization,
Exactly.
Yeah, that makes a lot of sense. And I love that. Very interesting. Cool. You mentioned hitting revenue targets. And I'm curious, like, how has growth been going at Aura? Do you find that stressful being at a company that has, candidly raised a lot of money, has high growth expectations? You're kind of at the center of that. How do you kind of navigate that?
Yeah. Look, revenue solves a lot of problems. Let me just
Sure.
say that straight out. I'm the commercial officer at Aura, and I'm responsible for that. So I do think about that a lot. One of the things, though, I am really proud of over the last 3 years, we've doubled our revenue every year. But more importantly, the number of members we have reached. And we've been public about this. We've sold over 5.5 million rings worldwide. And as we're doubling every year, the impact of that starts to really matter. Um, what I get excited about that, and yes, there is pressure on that to continue to grow and to reach more people. But what I get excited about is that unlocks for us a really exciting roadmap that we can bring better health and more trusted intelligence to more people. So when we continue to expand the use cases that these continuous wearables can really create value, whether that's women's health, cardiovascular health, stress, resilience, getting that early awareness, it really motivates me because I know the things that we have ahead. One of the key sort of North Stars that my team thinks about is not just how do we extract more dollars from members. We actually really think about access and how do we improve access for people. So we became the first HSA FSA wearable. I'm really proud to share that the majority of our members ask for a receipt for reimbursement for that or a direct pay. It really tells you something about the people that are using Aura. And as we've deepened into the ecosystem, I gave you some examples of payers and provider partnerships. Those integrations and that sort of interoperability has created more meaningful clinical value, which has enabled more payers, employers, providers to actually, look at reducing the cost of Aura to more people because they can see the value. That is really meaningful for me. And so as opposed to just sort of like looking at that as a metric of how do you improve revenue, I sort of look at it as how does that improve our roadmap, improve our access so that this can be democratized to more people and really scale that way.
Yeah, that makes a ton of sense. And so I'm curious for like kind of the general growth strategy today. Like, is it to do you guys want to get rings into as many people's fingers as possible and then kind of expand that way? Or from like a channel perspective, like employers, payers, et cetera, how would you kind of like weight the various ways of growing?
Yes, for sure. We want to reach more people. Our mission is to help more people realize health as a daily practice, right? We really believe strongly in that. Um, a huge amount of our emphasis this year is on international. The majority of our growth has been US focused. We believe that we can have broader impact international too. And then in the US specifically, we weight a lot of our efforts, particularly in moving more from wellness towards clinical
Mm,
risk signals. I mentioned some of those like hypertension. It's particularly important in a membership base that has, using us for their fertility journeys. And so you can put hypertension with pregnancy and just, the massive unlocks and changes and outcomes that you could have there. So we will continue to work with the clinical community, care teams to help them surface a lot of this sooner. And that will ideally lower the barrier to entry and improve the access for more people. So that is equally as important to us as just expanding
yeah.
geographically.
Yeah. That makes a ton of sense. So, and correct me if I'm wrong, but kind of you guys want to more firmly entrench yourselves as maybe like a clinically validated tool to use. So, like moving from like a wellness benefit or like a nice to have thing to a, hey, this has meaningful behavior change and like clinical insights for your member.
That's right. I mean, without that, we don't think we can have meaningful changes in health outcomes, right? So we don't just want to play on the surface of this. We want to really change health outcomes.
Yeah. Yeah. That makes sense. I love that. Um, and just on continuing to talk about, growth and revenue and different channels and those sorts of things, like how did how does your experience from, Airbnb and past roles, how does that translate? Like how is it different? And how has it kind of helped you maybe look at things differently in healthcare and that sort of thing?
I mean, when I first joined Aura, I felt like I had a lot of imposter syndrome. I have hired an amazing clinical health team at Aura. The chief medical officer, Dr. Ricky Bloomfield, has hired an incredible team of brilliant physicians and people with strong experience in outcomes research and in FDA work. I've also hired incredible people who have enterprise healthcare experience working with payers and providers. These people are way smarter than me, Blake. And when I first joined, I had this imposter syndrome, this language that I didn't understand at all. And then I started to see patterns of things that had happened in my career. I'd worked in highly regulated industries like payments, changing home sharing into a sort of
Yeah.
a noun and a verb with Airbnb. But to go from couch surfing to home sharing was like a big change. And so I started to see that I had actually a lot to bring to the table in sort of questioning and thinking a little outside the box of how we approach this. One of the best lessons in my career has been that actually the more that you partner and have an open ecosystem to enabling and understanding the problems that the partners that you work with have, the better off you'll be. And so we don't have this sort of closed wall garden approach at Aura. We have this ecosystem approach. We believe that our members, through their consent, should be able to bring and use their data to the experiences in their clinical settings that are useful to them. And so working with the system on that has been not easy. Everyone is overwhelmed with more data, that is for sure. But when we have worked really closely with some of those innovative partners on what is the right insight that would help the end member, that would help the physician and the care team, it's worked really well. And so some of those lessons are the same threads across my career that I found.
Yeah. I love that. That's interesting. Door, you go by Door.
I
I love
do.
that. That's awesome. Where did that come from?
It's fun, but it was my pet name growing up. My parents called me Dor. And I was really excited when I joined Oura that Tom asked me, Tom's our CEO, he asked me early on, you know, what do you prefer to be go by, Dor or Dorothy? And it was the first time in my career that I was like, no, I want to be Dor here. I wanted to be just myself. There's no formality. What you see is what you get. I can be my best self when I am authentic and true.
Yeah, I love that. And um, earlier, you kind of talked about imposter syndrome. I feel like that's the thing a lot of people deal with. I deal with it. I've been in healthcare, writing about healthcare, et cetera, for 8 years, and I feel like I, don't belong. So, where do you feel like, one, do you feel like you still deal with that to some extent? And two, how did you kind of go from, I don't know anything, I'm surrounded by really smart people, to, hey, I now can start questioning things, if that makes sense?
I mean, I think time will give us that, but I think it's humility to learn. I probably ask more questions than I answer. It's the humility to learn from others. I also think just because something hasn't worked in the past doesn't mean that it won't work now. We have so many new technologies. I'm so excited about this moment with AI and how it can help all of us. I think the most important industry that it can support is healthcare. And what a time to be working in it, right? What an exciting, I get so much energy when I think of what's possible. What might have taken 20, 30, maybe 50 years to happen might happen in a year, right? And to have a seat at the table to watch that unfold, to have a seat to be able to make decisions that could actually enable that to be more useful to more people. I just get very inspired by that. Um, I do still have imposter syndrome, and I meet it every day by listening to podcasts like yours, Blake. I read books. I consume, devour articles. I ask my different LLMs that I use for answers to what does that mean? What is that acronym? And I have no shame in that. I think we're all, on a journey of learning.
Yeah. Likewise, I feel like for me, it's like, I can only know so much information, right? And to your point, like having the humility to say, I don't know this. I want to learn from others, and that's okay. But also, like, I know intrinsically I'm capable, and you yourself, with your background, you are capable and a smart person, and like can learn and collaborate. So I think that's the best approach. It's just hard to always remember that in the moment, right?
For sure.
One thing I wanted to, one more Aura question, then I'll wrap up with my kind of personal podcast question. You did mention kind of Aura's strategy is more of a, an open ecosystem and in partnerships and those sorts of things. But at the same time, you still kind of want to be selective around your partners, right? Like, where do we feel like we can partner? What are the right characteristics of a partner? So could you kind of break down your partnership strategy for me, and like how you choose who to talk to and who you want to get in front of, and then kind of those sorts of things?
Yes, this is a great question. The good news for Aura right now is we have more opportunities than maybe we have people and time. Our strategy has always been to be an open platform, but a very intentional open platform. And so on the one hand, health is inherently interconnected, right? That's why it's so complicated to change. There's no single company that can solve it alone. So to me, interoperability is an inevitable, it's important, and partnerships in that are critical, whether that's with payers or providers or health technologies. So openness doesn't mean everything connects everything. I think we're selective of where we go deep, and we prioritize partners that meet a few really key criteria. One, I think it's focused on driving outcomes and not just accessing the data. So partners that actually want to change care pathways, the engagement, the decision making. So they want to use the Aura data for those things. Two, and this has been a lesson and a really important one with some of our work with, I mentioned Essence earlier, but fitting into real workflows, whether that's the payer care program or the provider workflow or an employee benefit, we really want to fit into real workflows. I think three is about our standards of privacy and trust. I talked about explicit consent, no selling of data, user control. We feel very strongly and passionate about that. And four, there's sort of compliance or not compliant, they're sort of a complement our signal. So, for example, pairing longitudinal health data with clinical or metabolic health data in a way that creates kind of a new insight. We think of that as really important. And then maybe lastly, the secret ingredient, I think, that's maybe not always said is people do deals. People do partnerships. Companies don't. And so I often think it's the people you're looking across at that table. And are they really in it with you? Do they have that innovative spirit that they want to do this? Are they really aligned to the same values and outcomes that you are? Are your incentives aligned on that? And that is like a little bit more like of the je ne sais quoi. I don't know. Like it's hard to like articulate it. Like you can't put it in a box, but you know when you feel it. And I work with some amazing people on my team and we talk about this. It's like, do we have the right partner at the table? Do we have the right champion at the table who really wants to be innovative with us?
Yeah. Yeah. I love that. And for listeners of the Hospitalogy podcast, are there any key kind of partnership areas or upcoming that like we should look for to hear from you guys in the upcoming year?
Yeah, I think we're still focused on sort of that North Star access. So payers, providers that want to be really innovative.
Yeah.
Second thing is sort of focused on those health outcomes, metabolic health. We have a lot of our members increasingly on GLP-1s. We're seeing incredible longitudinal data for those that are on GLP-1s. We have an incredible integration with Dexcom where we offer our members CGM sensors. So metabolic health and cardiovascular health are really important to us. And then finally, I think clinical AI integrations, where the continuous nature of data can create this really personalized experience. We're like very excited about some of our own AI and then connecting that with other clinical AI protocols and how that can work.
Yeah, well, that's super exciting. It sounds like, you've got more than enough things going on. So maybe hire a couple more people to help you out with that.
We definitely are hiring.
All right, there you go. Yeah. Well, I'll be following along with that. And with one final question for you that I always ask every podcast guest is, what is a piece of content or, some sort of media or whatever that might look like? So any form of, book, anything like that, that has kind of fundamentally changed how you, view your life or live your life?
Gosh, it's hard to distill it to one. Let me think about that. Maybe just a piece of advice that I got rather than a specific book or a podcast. I think about my own health journey and the challenges that I faced. And I think they're very similar to a lot of people's challenges, sometimes more high risk and at different moments in their journey. But you can't improve what you don't measure. And you also can't obsess over what you don't understand. I've shifted how I approach my own health. It's not about tracking everything perfectly. It's about noticing patterns over time and making small, consistent changes. I think in health, we often feel like things are happening and it's out of our control, different diagnoses, different things, and that we have so little in our control because we typically find out when we are sick and when it's late. And my hope is that just like my own journey is when I can see those patterns earlier, I can take action earlier. It's like our bodies are screaming at us and we sometimes just don't know how to listen. So that mindset of awareness over perfection, that's been really powerful to me. And that's kind of the sort of advice and the sort of, I think that thread has just always stayed with me, especially with my work at Oura.
I love that. And I'm the same way, because I'm a big numbers guy and charts and all that stuff. And so I would try to track everything I ate. And it wasn't sustainable for me. So I love that approach as far as, finding the patterns that work for you and trying to find something like actually sustainable that you're gonna stick with, which sounds pretty in line with Oura in general, and the behavior change and all things in between. So Dort, thank you so much for joining me on today's podcast. Really enjoyed getting to know you and learning about what you guys are up to. And best of luck to you guys the rest of the year.
Thanks so much, Blake. Appreciate it.